Assalamu alaikum, yes, this is Dr. Khawaja Sajjid Aslam with the program Born in Health today. Our topic today is Hallux Valgus. Many of you must know what it is actually, Hallux Valgus. It's more common in females after the age of 50 or 55. You must have noticed that the big toe of feet is moving inward. So if it's a big toe, it keep on moving inward. So this part, this metatarsophalangeal joint, this part of the joint, getting more and more prominent. Once it's more prominent, your toes become mingled with each other, and the metatarsophalangeal joint, the proximal part of the big toe, getting more and more prominent, and it's keep on rubbing with the shoe, become red, become inflamed, infected, gives much pain, especially on walking, even sometimes without walking as well. So it's a terrible condition. Actually, any problem involving the feet is really terrible, because with the hand you don't walk, so you can tolerate the pain, you can elevate, you can still walk, you can go to work. But problem with the feet, any kind of problem with the feet, is really horrible, because you cannot walk. You cannot walk even one step. You cannot go to toilet or even. So Hallux valgus is a treatable, is a curable problem. Why it happens is most common, as I said, in females after the age of 50 or 55. Some correlation with diabetes as well. Why it's more common in women? Because women's shoes are quite fancy. They are pointed from the front and broad from the back. So more pointed shoes on the front, they will keep the toes very tight to each other. So that's one of the provocating cause to go for Hallux valgus. And also in those young girls, especially who wear the pointed shoes or very tight shoes, or one size less shoes, one size less of their own original size shoes. So this Hallux valgus is more common in those people. Very important, just don't wear pointed shoes. If you have to wear the pointed shoes for your parties, then of course wear for the short period. If you wear for the short period, of course then the problem will be less. But if you keep on wearing for hours and hours, or even daily basis, or even if you go to work or walk and wearing these tight pointed shoes, of course your problem will increase day by day, and very soon you will get this Hallux valgus, which will be more and more problematic, and you end up with the surgical intervention. So important is always wear a little bit broad shoes from the front. Just like men's shoes, they are broad from the front. That's one of the reasons as well that this problem is less common in males as compared to females. Once you started to feel that there is redness over the metatarsophalangeal joint, start thinking you have to change the shoes. Why I keep on saying about the shoes? Because main problem is the shoes. Main causative factor is the tight shoes. So you can apply the oil on this red part. You can take some painkillers. You can keep some wedges. There are physiotherapists, they can provide you this plastic gelinate wedges, which you can keep between big toe and second toe and interdigital space, so that it will keep your toes a bit straightened gradually, slowly, and it will stay straight. And but once it's advanced stage, as in our country, many people they present once it's already advanced, because they keep on ignoring themselves, then there is no other remedy except the surgical intervention. But I would say the surgical intervention is curative. It's quite good. Many people, they are afraid that because I have diabetes mellitus, so I shall not go for any surgical intervention for feet. I think I did a couple of programs earlier as well about the diabetes mellitus and surgical intervention. I would just briefly tell you that the only difference between a diabetic and a non-diabetic patient is the chances of infection in a diabetic patient is slightly higher than the one in non-diabetic person. But the wound healing time is same. If non-diabetic patients wound heals in 2 weeks time, in diabetic patients same, 2 weeks time wound will heal. But the chances of infection are slightly higher than the non-diabetic person. But if your sugar is controlled, if diabetes is controlled, of course your chances will quietly same as a non-diabetic person. So if this is troublesome, this problem is too much for your daily routine activities and your social activities, go ahead for surgical intervention. On display is my number. If you want to discuss further or you want to get appointment, you are most welcome. Thank you.